Many people experience an upset stomach. It can be confusing to determine the cause. Is it a stomach virus? Or could it be food poisoning? Knowing the difference is important. It helps you get the right treatment. This essay will explore the differences between these two common conditions. Understanding the causes, symptoms, and prevention methods can help you stay healthy. We'll delve into the details of stomach viruses and food poisoning. This will equip you with the knowledge to handle these unpleasant situations. Let's start by understanding what each condition entails. This essay will provide valuable insights to help you differentiate between a stomach virus and food poisoning. It will guide you on how to manage these conditions effectively. Let's dive in and empower ourselves with knowledge. A stomach virus, also known as viral gastroenteritis, is an infection that affects the digestive system. This infection is caused by various viruses. Common culprits include norovirus, rotavirus, adenovirus, and astroviruses. These viruses can spread easily. They often contaminate food and water. Transmission occurs through contact with infected individuals. This can happen through direct contact or sharing utensils. Symptoms of a stomach virus often include nausea, vomiting, diarrhea, and stomach cramps. These symptoms typically appear within 12 to 48 hours after exposure to the virus. Stomach viruses are highly contagious. They can spread rapidly in closed environments like schools, daycare centers, and cruise ships. Practicing good hygiene, such as frequent hand washing, is crucial in preventing the spread of these viruses. Food poisoning, unlike a stomach virus, is caused by bacteria or toxins found in contaminated food. Common culprits include bacteria like Salmonella, E. coli, and Staphylococcus. These bacteria can multiply rapidly in food that has not been stored or handled properly. Consuming contaminated food can lead to a range of unpleasant symptoms. These symptoms can vary depending on the type of bacteria ingested and the amount consumed. Food poisoning is a serious health concern. It's important to practice food safety measures. These measures include proper hand washing, cooking food thoroughly, and storing food at the correct temperatures. By following these guidelines, you can minimize the risk of food poisoning. The term stomach flu is often used interchangeably with stomach virus. However, it's important to note that influenza, commonly known as the flu, is a respiratory illness caused by the influenza virus. The flu primarily affects the respiratory system, including the nose, throat, and lungs. Stomach viruses, on the other hand, specifically target the digestive system. They cause inflammation in the stomach and intestines. While both conditions can cause nausea and vomiting, they are distinct illnesses with different causes and treatments. Understanding the difference between these two illnesses is crucial for seeking appropriate medical care. If you experience symptoms like fever, cough, and body aches, it's more likely to be the flu. Stomach viruses typically manifest as digestive issues like vomiting and diarrhea. Section 5. Symptom timeline. When to worry. The onset and duration of symptoms can provide valuable clues in differentiating between a stomach virus and food poisoning. Understanding these timelines can help you decide when to seek medical attention and when to manage symptoms at home. Stomach viruses typically have an incubation period of 12 to 48 hours. This means that after being exposed to the virus, it can take up to 2 days for symptoms to manifest. This delay can make it challenging to pinpoint the exact source of the virus, as you may not immediately connect your symptoms to a specific event or exposure. Food poisoning, however, tends to have a much faster onset. Symptoms can appear within a few hours or even minutes of consuming contaminated food. This rapid onset can make it easier to identify the culprit, often a recent meal or snack. Symptoms can include nausea, vomiting, diarrhea, and stomach cramps. The sudden and intense nature of these symptoms can be alarming, but they often resolve quickly with proper care. The severity and duration of symptoms can vary depending on the type of bacteria or virus involved. Some cases may be mild and short-lived, while others can be more severe and prolonged. In general, stomach viruses tend to resolve within 1 to 3 days, although some cases may last up to 10 days. During this time, it's important to stay hydrated and rest as much as possible. Food poisoning symptoms usually subside within 24 to 48 hours, but some types of food poisoning can last longer and may require medical attention. If symptoms persist or worsen, it's crucial to seek medical advice to prevent complications. Section 6. Transmission and contamination routes. Stomach viruses are highly contagious and can spread easily through various routes. These viruses are often resilient and can survive on surfaces for extended periods, making it easier for them to infect multiple people. One common route is person-to-person contact, such as shaking hands with an infected individual or touching contaminated surfaces. Everyday objects like doorknobs, light switches, and even mobile phones can harbor these viruses, facilitating their spread. Viruses can also spread through the air, particularly in enclosed spaces, when an infected person vomits or has diarrhea. The tiny particles released can linger in the air and be inhaled by others, leading to new infections. This is especially concerning in crowded places like schools, offices, and public transportation. Food and water can also become contaminated with viruses, especially if they come into contact with infected feces. This contamination can occur in various ways, such as through improper sewage disposal or when infected individuals handle food without washing their hands. This can occur due to poor hygiene practices during food preparation or handling. For instance, a chef or food handler who does not wash their hands properly after using the restroom can transfer viruses to the food they are preparing. Additionally, swimming in contaminated water can also lead to infection. Public swimming pools, lakes, and other bodies of water can become breeding grounds for viruses if they are not properly maintained and sanitized. Food poisoning, on the other hand, typically occurs when food is contaminated with harmful bacteria. These bacteria can multiply rapidly under the right conditions, leading to severe illness. This can happen at any stage of the food production process, from harvesting and processing to preparation and storage. Contamination can occur in the fields where crops are grown, in the factories where food is processed, or in the kitchens where meals are prepared. Common sources of food contamination include raw or undercooked meat, poultry and seafood, unpasteurized dairy products, and improperly handled or stored food items, and fruits and vegetables that have not been washed properly. Ensuring that produce is thoroughly washed and that all food items are cooked to the appropriate temperatures can significantly reduce the risk of contamination and illness. Section 7. Spotting the differences. Symptoms. While both stomach viruses and food poisoning can cause gastrointestinal distress, there are some key differences in their symptoms. Understanding these differences can help in identifying the cause and seeking appropriate treatment. Stomach viruses often cause a combination of symptoms, including nausea, vomiting, diarrhea, stomach cramps, and low-grade fever. These symptoms can appear suddenly and may last for several days, making the patient feel extremely uncomfortable. These symptoms are typically more generalized and affect the entire digestive system. The virus can spread easily from person to person, especially in close quarters, leading to outbreaks in schools, workplaces, and other communal settings. Food poisoning, on the other hand, tends to manifest as more localized symptoms, primarily affecting the stomach and intestines. Common symptoms include nausea, vomiting, diarrhea, abdominal cramps, and sometimes fever. These symptoms usually appear within hours of consuming contaminated food or water. The fever associated with food poisoning can be higher than that of a stomach virus, and the onset of symptoms is often more abrupt. The severity of symptoms can vary depending on the type of bacteria or toxin ingested. Common culprits include Salmonella, E. coli, and Listeria, each causing a different range of symptoms and severity. In some cases, food poisoning can cause more severe symptoms, such as bloody diarrhea, severe dehydration, and neurological problems. These severe cases may require hospitalization and intensive medical care to manage the symptoms and prevent complications. If you experience any of these symptoms, it's important to seek medical attention immediately. Early diagnosis and treatment can help prevent the condition from worsening and ensure a quicker recovery. Section 8. Diagnosis and treatment approaches. Diagnosing a stomach virus or food poisoning typically involves a combination of a physical exam, a review of symptoms, and sometimes laboratory tests. Doctors will ask about your medical history, recent travels, and any potential exposures to contaminated food or water. In some cases, a stool sample may be collected and analyzed to identify the specific virus or bacteria causing the illness. However, in many cases, the diagnosis is made based on symptoms alone, as treatment for both conditions is often similar. Treatment for both stomach viruses and food poisoning primarily focuses on relieving symptoms and preventing dehydration. Rest, fluids, and over-the-counter medications for nausea, vomiting, and diarrhea are typically recommended. In more severe cases, hospitalization may be necessary to provide intravenous fluids and electrolytes. Section 9. Prevention is key. Staying healthy. Preventing stomach viruses and food poisoning involves practicing good hygiene and food safety measures. Washing your hands frequently with soap and water, especially after using the bathroom, changing diapers, and before preparing or eating food, is crucial. Avoid close contact with individuals who are sick and disinfect frequently touched surfaces regularly. When it comes to food safety, make sure to cook food thoroughly, especially meat, poultry, and seafood. Wash fruits and vegetables thoroughly under running water before eating or preparing them. Store food properly in the refrigerator or freezer, and avoid cross-contaminating raw and cooked foods. By following these simple yet effective measures, you can significantly reduce your risk of contracting a stomach virus or food poisoning. Remember, prevention is always better than cure.